Hello, my name is Dr. Raun Melmed. I'm a developmental pediatrician in Phoenix, Arizona, and I wanted to speak to you about screening for autism spectrum disorders specifically. There are three components to the screening process. First of all, we talk about developmental surveillance. That is the gut feeling that a pediatrician has when something is not quite right. We might get that from the history, we might get that from the physical, we might get that from a parent concern. When there's something not right, and we think that there might be something unusual about the child, that is definitely a sign that the child might be at risk. The second part of the screening process is when we use an autism-specific screening tool, such as the MCHAT, which I know is familiar to many people. And once you implement that in your practice, you'll have a far more effective tool at your fingertips to ensure that no child between 18 and 24 months of age is missed. Of course, we do all these screening tools on typical children, not the ones we suspect might have an autism spectrum disorder. Lastly, there are several red flags that really concern us. And if a child misses several of the red flags, then that too is an issue which we must follow up on. The red flags include issues such as ensuring that there's been no regression, no loss of any skills, certainly no loss of social skills or of language skills. If the child doesn't have a two-word phrase by the age of 2 years, that's a concern as well. If they don't use or have a spontaneous vocabulary of about 50 words at the age of 2, that too would be a major concern. So, in your practice, we utilize developmental surveillance, an autism-specific screening tool, and some of the red flags. Go ahead, get your feet wet. Order the MCHAT. It's free, it's quick, it's easy, and of course you can get reimbursed for it. And you'll do a great service in ensuring that no child in your practice between the ages of 18 and 24 months will be missed.